got fewer sick animals and more new animals, and you can switch the thing. But a clean break is really just what it sounds like. You are having totally separate populations, and that's the way that you can continue to operate the shelter. It's a challenge, and it's a lot of hard work, but it's the way to manage some of these things in a life-saving way. Skipping some stuff. Prevention is best, right? It's always best. So screening on intake, vaccination on intake, and when I say screening, I mean a visual exam by someone who's trained to know what abnormal is. You don't need to be trained to know the fancy vet name for something. You just can say cloudy eye, you know. Something doesn't look right. Like our shelter in Madison where I worked, it was people that worked at the pet store and came and learned to do intake exams, and those people were amazing and learned to detect heart murmurs and all the things. And I was always very clear, like, I don't care what words you use to describe it, just say something's not right and flag it for a vet to look at. So intake screening, for cats we're going to use a woods lamp to check for ringworm on intake, and then daily monitoring as the animals are in the shelter. Okay, so these are kind of your tenets of infectious disease prevention in a shelter. Vaccination, double compartment housing, prompt recognition of disease, separation of sick and healthy, rescue, good biosecurity, and then in the face of an outbreak, accurate diagnosis and implementation of a management plan. Okay, we've got 5 minutes, and I've got some cases. I know which one we're gonna do. Okay, we're not gonna do this one, we'll go back to it. I think I made it now. It was too fast. Oh, please, we're almost there. Okay, here we go. See if it's gonna go. Okay, I'll do that. Yeah, it does. Here, I'll read. Okay, I'm going to read the thing. We have a municipal shelter in the Midwest. 2 unrelated dogs developed lethargy and severe pneumonia within 24 hours of each other. They were so sick they needed to be euthanized. Thank you. One of these dogs was spayed the day before development of clinical signs, okay? Both of them were vaccinated on intake. What questions? What do you want to know? What do we want to know about these dogs to try to figure out what's going on?
Where they came from.
Where they come from?
Yep, that's right. Thank you. Sorry, say again?
Where they came from.
Where they came from. They're both local stray intake through animal control.
Who else was at surgery when she was sick?
Both adults, good question.
How long before symptoms arose were they surrendered?
How long, what time?
Arrival at the shelter.
Yes, exactly. When did clinical signs develop relative to intake? What do we want to know about the shelter?
What's their cleaning protocol?
Cleaning protocol. Yep, we want to know how many dogs they have. We want to know, are there more sick dogs than usual? Clinical signs developed 10 and for the other dog 12 days after intake. And this is a true case too. Okay, so we went ahead and sent out respiratory panels on these dogs. Streptococcus equi subspecies zoepidemicus, which we just like to call strep zo, positive. Okay, so if you read in the books about strep zo, you're going to hear the classic presentation: dead dog in its kennel, blood coming from its nose and maybe its mouth. That's what we typically hear. That is not what we saw in either case. No blood. We had lethargic, pneumonia, massive decline despite hospitalization and needing euthanasia. Okay? Everything else was negative. So our next steps for strep zo, this is one case where we treat everybody regardless of clinical signs with antibiotics. And it feels like just the opposite of everything as a vet. We're told to be responsible antibiotic stewards, and strep zo is the one time where you need to treat because dogs will die without treatment. So you can do it with penicillin G every 3 days, an injection. If you can't handle them for an injection, you can use cefpodoxime, which Simplicef is the brand name for that, although now it's generic, thankfully, and not as expensive. Convenia, if you've got the dough, that's an injection, and you can use that for basically the treatment course. Some people will repeat it a week later. So we treat all the dogs. We really want to stop intake on this one. If you can't, you've got to treat everybody coming in with penicillin, because you're basically bringing these dogs into a contaminated environment. And anytime somebody says they can't stop intake, I really, really question if that's true. It might feel like you can't. I know a lot of shelters, municipal, high volume shelters, who have stopped intake, and most of you probably have the word humane in your name or welfare or something in your mission, right? And so bringing healthy animals into a space where they are going to get sick is not humane, and that's not what any of us want to do, right? And so that's where I challenge folks to push back a little bit on your municipality or whoever it is that's saying you have to take them in. Like, sometimes that's really not the best choice. We go on a biofilm hunt. A biofilm is basically an armor over bacteria. So strep zo is a bacteria. We have found it inside a bin of rescue, a barrel of rescue. Like biofilm, it is like an armor, and so it can protect that bacteria. And we had a shelter that was spraying rescue all over their kennels, and all the dogs were getting strep zo. It can end up in really funny places. So you go and you look and do a deep clean, anything that's grimy, big scrub, big deep clean. But the biggest thing we need to do is address our capacity for care issues. So this shelter had more dogs. They had 75% of their guillotines were down, so dogs were in like a 4x4 space, and this was a shelter with mostly large, energetic dogs. They had, I think they had about 80 dogs at the time, and then the previous few weeks they had even more than that. And so it was like they had gone way over their capacity and were coming down from it. And so in reality, I think strep zo is probably hanging out in a lot of shelters, but like we'll talk about on the next session, like exposure doesn't equate to infection always, right? There's kind of the perfect storm that has to happen for animals to get sick from something. So you might have strep zo in your shelter, and it's not going to rear its ugly head until you are way over your capacity. Dogs are super stressed, guillotines are closed, that sort of thing. So that's why we're so intense about, like keeping your portals open, stay double-sided. Okay, that was my time. I actually went overtime. But I think that was pretty good, given all our technical problems.
Yeah.
And, oh, last thing I do have to say this. So distemper, we used to say dogs with distemper needed 2 negative PCRs in a row before they were cleared. Our program did a study because we've sampled thousands and thousands of dogs with distemper. So this paper came out 2 Januaries ago, I think. And what we found was that after dogs reach their peak shedding, which happens pretty quickly, 2 to 3 days after that, they're no longer infectious. This is huge, okay? So we've had a lot of shelters euthanize dogs because they're like, we can't hold them for the months it might take for them to clear. We've had dogs in this study almost a year before they had 2 negative PCRs. And we're like, they can't possibly still be infectious. They've been running around fine for like 11 and a half months. How are they still infectious? And so what was done was PCR in combination with what's called virus isolation, which basically you grow the virus to see if it's viable. Is it alive? Is it infectious? And what we found was no, it wasn't infectious. And so the way how that shows up in a practical sense is right here at the bottom. Once the peak of viral shedding has passed and clinical signs have resolved, if you've got neurologic signs that have stuck around a little bit, like sometimes you'll get some myoclonus or muscle twitching that won't go away. But if no new clinical signs have appeared and other clinical signs have resolved, you can consider the dog to be non-infectious and let them go. And this is a beautiful thing, because this is sometimes like 2 weeks after diagnosis or less. So this is a big life-saving thing. Maddie's Fund helped fund that work too. So thanks very much. Happy to answer questions. I'm at this table over here if y'all need bathroom break and want to just find me individually. But I know we have a little bit of a break, and then we'll come back to talk ringworm.